Welcome to MS Research Australia's Research Report. I'm Dr Hamish Campbell, and in this series we explore the research that's going on in Australia and around the world. This episode is a bit of a throwback to our discussions with Dr Jennifer Massey regarding AHSCT at our research conference last year. Let's have a look.
So I'm Jennifer Massey. I'm a MS Research Fellow based at St Vincent's Hospital in Sydney, and been privileged to work on my PhD with St Vincent's Applied Medical Research Centre into the role of autologous stem cell transplant for multiple sclerosis. Autologous stem cell transplant is often abbreviated to stem cell therapy or stem cell treatment, and I think that is where a lot of misconception arises, because this sort of concept of stem cells as having a regenerative potential can be interpreted as rebuilding or fixing some of the damage that's been associated with MS. When we look at autologous stem cell transplantation of hematopoietic stem cells, what we mean is encouraging the body with medication, so drugs like cyclophosphamide and medication that boost the bone marrow to make hematopoietic stem cells, and then we use high doses of chemotherapy to ablate or to remove the patient's immune system and then rebuild that immune system by infusing these stem cells. So those stem cells are predominantly used to rescue patients who have had high-dose chemotherapy from the very low counts of their immune system that happen after that. So this is, there has still not been any large phase 3 sort of randomised trials of this treatment, and so internationally most work has been done as part of sort of phase 2 or observational studies. And from those studies we are gaining insights into the mechanism of action of this treatment. Early on, we sort of conceptualised that just by giving very high doses of chemotherapy, we could knock out, any potentially autoreactive or self-reactive cells that are driving MS. And over time, we're beginning to get a better idea of, mechanisms beyond that. So certainly in the initial period, the chemotherapy seems to be very effective, but the benefit of this treatment outstands or outlasts the duration of the effect of the chemotherapy, and so we wonder about the ability of the immune system to rebuild after the infusion of those stem cells, and where those stem cells go and how they expand in the body after the chemotherapy is where we're sort of developing our clinical and research interest. So at St Vincent's in Sydney, we've had ethics approval to look at the role of stem cell transplant in a host of different autoimmune conditions, one of which is MS. So the first patient underwent autologous stem cell transplant in December of 2010, and as of mid this year, we have now taken 40 patients through the process of autograft. We have followed up our patients now to sort of a median of just over 2 years, and so we're beginning to see how they do over time. So far, within this patient cohort of patients who have got aggressive disease, we've had very impressive outcomes, but we still have a lot to learn about about which patients are most eligible and how to take this treatment forward in the future. Yeah, so from a clinical point of view, I'm very interested in how we can best assess patients pre and post-transplant. So looking at measures beyond just the physical disability, but looking at their cognitive function. We record our quality of life studies in all of our patients, and continuing that into the future, and also looking at radiological measures of disease activity. So we're getting very, advanced MRI scanners now that we need to make the most use of, and so being able to look at all the data that can provide us. In terms of the laboratory side of things, I'm very interested in trying to look at how the immune system rebuilds after stem cell transplant, and so looking at the different lymphocyte populations, different time points, and we've been very lucky that all of our patients have been supportive in this research and have given blood samples for us to analyse, so we can try and optimise what is currently a pretty intense, it's a bit of a hammer of a therapy, and try and refine that in the future. Yeah, so MS Research Australia have a fantastic website, and I think if you search within that, there's previous interviews and work that John Moore, the haematologist at our centre, has put up there, and I think there's more information about the ongoing projects on that site.
Now that is a very brief snapshot of Dr. Massey's work. Now if you want more information on AHSCT, make sure you go to our website. Also, like us on Facebook and subscribe to our YouTube channel for future research reports. I'm Dr. Hamish Campbell, and I'll see you next time.